disease condition in that is hydrocephalus. In order to understand about hydrocephalus, we need to understand about the normal production of the CSF, which is cerebrospinal fluid, and also we need to understand how it circulates through the central nervous system. So first, regarding the CSF production, as we know that CSF is produced by the choroid plexus. It is produced by the choroid plexus, which are usually in where? Lateral ventricle. We have that in the third ventricle and also in the fourth ventricle. So the question remains is how much amount of the CSF is produced on daily basis, or how much is the amount of the CSF which is considered to be the normal within the central nervous system. If we talk about the total volume of the CSF, that is ranges between 120 to 150 ml of the CSF is normal. So an individual who has CSF amount of 120 to 150 ml will be considered as the containing normal amount of the CSF within the central nervous system. Okay, so now how much is produced on daily basis or per minute? If we say how much is produced, there is 0.20 to 0.35 ml of the CSF produced per minute. Where does the CSF produce from? It is produced by the choroid plexus, again, which are in the lateral ventricle, third ventricle and the fourth ventricle. Now if we talk about the circulation of the CSF, once the CSF is produced inside the lateral ventricle, it is circulated through the foramen of Monro. Okay, then from foramen of Monro it goes to the third ventricle, and from the through the aqueduct of the pelvis into the fourth ventricle, and from the fourth ventricle it will go to the subarachnoid space. So this was regarding the normal CSF circulation within our central nervous system. This is within the cranium, and then it will go to the subarachnoid space. From there it will be circulated downwards to the brainstem through into the subarachnoid spaces. Okay. So to the what actually hydrocephalus means. What hydrocephalus is now, it is increase. This indicates increase in the volume of CSF within the CNS. And also, whenever there is an increase in the volume of the central nervous system, as we saw, ventricular system, it is how it is designed. So whenever there is an increase in the volume of the CSF, what it will do is it will also cause increase in the intracranial pressure. Once there is an increase in the intracranial pressure, obviously whenever there is an increased pressure inside the cranium, whatever is inside the cranium will lead to the dilatation of the products of the, which are usually the ventricles. So it will also be followed by the dilatation of ventricles and increased intracranial pressure. So what is hydrocephalus now? It is increase in the volume of the cerebrospinal fluid within the CNS, and there is also dilatation of the ventricles, and also there is increase in the, we shall write increase in the intracranial first, then we will write dilatation of the ventricles, because of the increase of the increase within the cranium, increased pressure is pressure within the cranium, there will be dilatation of the ventricles. So this is regarding the definition. Now we have different types of the hydrocephalus, which are primary, secondary, then in there we have communicating, non-communicating. We will learn about them, and also about the etiopathogenesis of each of these factors. So definition. First we will learn about types. Types of hydrocephalus. There are usually two types, primary and secondary. First we will discuss regarding primary. What is primary is? Primary means acute increase in the production of the CSF. So acute increase in the volume of the CSF within the central nervous system, more commonly within the ventricular system. So it is acute increase in the volume of CSF leads to, also as I said earlier, we shall write increase in intracranial pressure first. Increase in intracranial pressure and dilatation of the ventricles. So primary is acute increase in the volume of the CSF, and also there is increase in the intracranial pressure and there is dilatation of the ventricles. So this is regarding the primary. Now what could be the causes or etiological factors which are responsible for causing primary hydrocephalus? Etiology, we usually have three etiological factors. First is obstruction to flow of CSF. So first we have obstruction to the flow of the CSF. Second we have overproduction of the CSF. Third is obviously deficient or defaint reabsorption of CSF. So three possible mechanisms could cause primary hydrocephalus. What are those three mechanisms is? First one is obstruction to the flow of the CSF. Whenever there is an obstruction to the flow of the CSF, which we learned earlier, which was flowing through from the lateral ventricle into the third ventricle and then into the fourth ventricle, from lateral ventricle through the foramen of Monro, and then from the aqueduct of Solvis it was going to the fourth ventricle and then accordingly into the subarachnoid space. Whenever there is an obstruction to the flow, to this flow, there is an increase in there will be an increased CSF which will be retained within the ventricular system, and that will lead to the increased intracranial pressure, as I said earlier, and also to the ventricular dilatation. Whenever the etiological factor is obstruction to the because of the obstruction of the flow of the CNS. CSF. It is termed as obstructive hydrocephalus. So whenever obstruction is the cause, the hydrocephalus is itself named after the obstruction, which becomes obstructive hydrocephalus. Other than that, there are other two possible mechanisms which are overproduction of the CSF. If the amount of the CSF which we learned was 0.20 to 0.35 ml per minute. If the amount of production of the CSF exceeds this limit, then also it can cause hydrocephalus. And then we also learned third mechanism is deficient reabsorption of the CSF. As we know that once the CSF is produced, it is also reabsorbed by the CNS, central nervous system. So whenever the reabsorption process is affected, or whenever there is a decrease in the reabsorption, whenever the amount produced exceeds the amount that needs to be absorbed, there it is also capable of causing hydrocephalus. So these are the three basic mechanisms, etiological factors which are responsible for causing primary hydrocephalus. So other than that, we also use communicating and non-communicating hydrocephalus. Within the primary hydrocephalus, there are other two terms which we use to designate hydrocephalus is primary and is communicating and non-communicating. So primary could be either non-communicating we'll discuss first, and then it could be also communicating. So these are two. These are all only communicating, non-communicating, and communicating is only used to signify the sites of the obstruction. So wherever the obstruction occurs, accordingly we call it as communicating, and also otherwise it is called as non-communicating. Depending upon this classification is only depending upon the sites of the obstruction. So we will discuss regarding the non-communicating hydrocephalus. What is non-communicating is whenever the obstruction occurs at third ventricle or at any site within the ventricular system, obviously, or at exit foramen. When the site of obstruction is either there is an obstruction at the third ventricle or there is an obstruction at the exit foramen, which where exit foramen, we learn it that exit foramen will then they will divert CSF towards the subarachnoid space. Whenever there is an obstruction at third ventricle or at the exit foramens, the hydrocephalus will be termed as non-communicating. Okay, so then what could be the causes for the non-communicating? Exit foramen or foramen of Lashka is one of the exit foramen, and now we will learn about causes of non-communicating hydrocephalus. On the basis of causes, it could be classified as congenital non-communicating hydrocephalus or acquired non-communicating hydrocephalus. First we will discuss about the congenital non-communicating hydrocephalus. Means if the those congenital conditions are those birth defects which lead to the development of the hydrocephalus. So most common is Arnold-Chiari syndrome. What is Arnold-Chiari syndrome? Is primary defect in the Arnold-Chiari syndrome is elongation of the medulla. As we know, there is formation of the mesencephalon and mesencephalon, which then gets converted into the cerebellum and medulla accordingly. So that is a separate topic altogether. But in case of the Arnold-Chiari, those children who have Arnold-Chiari syndrome are congenitally, they will be also developing hydrocephalus. Other than this, there is also intrauterine meningitis is among other causes of the congenital non-communicating hydrocephalus. As meningitis, as we know, anything it is inflammation of the CNS. So what happens in the meningitis is once there is inflammation of the CNS, the space, the ventricles will be enlarged, and also the foramen of magnum or whether it is any other transportation system of the CSF, it will be enlarged. So there will be obviously less space, or we can call it as stenosis will happen. So what is stenosis? That is narrowing of the passage, or otherwise stenosis could also be stenosis of aqueduct. Is also one of the causes. If there is congenital stenosis other than meningitis, also stenosis of aqueduct can occur, and that is also one of the etiological factors for causing congenitally non-communicating hydrocephalus. So these were congenital. Now we can also see about acquired non-communicating hydrocephalus. Causes for acquired non-communicating hydrocephalus. Acquired non-communicating hydrocephalus. As we know, so these causes must be acquired throughout the life. So one of the causes is like meningitis. which is not intrauterine meningitis. If child experiences, or any individual who gets meningitis in any way, at any time of the life, is also prone for development of the hydrocephalus. Or if meningitis leads to the development of the hydrocephalus, then we call meningitis. Then we call hydrocephalus as acquired non-communicating hydrocephalus because of the meningitis. Otherwise also there could be tumors within the ventricular system. Okay, that can also lead to the narrowing of the spaces for the circulation of the CSF. Or any abscess could also be the reason for the development of the hydrocephalus. Other than that, acquired hydrocephalus, there could also be other tumors, abscesses, ventricular hemorrhage, or subdural hematoma. So hemorrhages could also lead to the development of the hydrocephalus. Then it is called as acquired non-communicating hydrocephalus. So then we have the causes. First one was any inflammatory processes, like in case of the meningitis and also in case of the abscess. Then we have tumors also which develop within the ventricles, and then we also have any ventricular hemorrhage or subdural hematomas can also lead to the development of the acquired non-communicating hydrocephalus. Then we will go to the, next we will go to the communicating hydrocephalus. We saw non-communicating was restricted only within the ventricular system. Whenever there was an obstruction within the ventricular system, then we called hydrocephalus as non-communicating. So now in case of the communicating, there is an obstruction within the subarachnoid space. So that means CSF will be flowing freely throughout the ventricles. There will be no problem in the flow of the, there will be free flow of the CSF, and also it will lead to, and there is dilatation of ventricles, although CSF flows freely. Okay, so in case of the communicating hydrocephalus, there is an obstruction within the subarachnoid space. Okay, into the base of the in the base of the brain, and there is dilatation of the ventricles, although the CSF remains to continue flow freely, because there is no obstruction within the ventricular system. The obstruction this time lies inside the subarachnoid spaces. Okay, so this was regarding the non-communicating hydrocephalus. So now what are the causes for non-communicating hydrocephalus is, first one is overproduction of CSF. So where is overproduction of the CSF seen? It is seen in papillomas. Okay, if there is any papillomas within this central nervous system, then that could cause an overproduction of that could overstimulate the choroid plexus, and from there it could cause overproduction of the CSF. And also other possible mechanism, like we discussed earlier, was there were only three mechanisms which were responsible for causing hydrocephalus. First one was obstruction, second one was overproduction of the CSF. Now coming to the third, which is deficient reabsorption of the CSF. When could deficient reabsorption? Once a person has meningitis, following meningitis, there could be deficient reabsorption of the CS, central cerebrospinal fluid. Okay, so this was regarding the communicating, non-communicating. So this ends our primary hydrocephalus. Now we will go to secondary hydrocephalus. Secondary hydrocephalus. What is secondary hydrocephalus is? It is very less common. Okay, it is not usually seen, but it occurs because of the compensatory increase in the CSF. Why there is a compensatory increase? Because there is loss of the neural tissue, and this without increase in intracranial pressure. So what happens in case of the secondary hydrocephalus is that because of the loss of the neural tissue, there is compensatory increase in the CSF, although that increase exceeds the normal limit, say 150. The CSF increase is greater than 150 ml, but the increase is always compensatory. Okay, so and also there is no increase in the intracranial pressure. Why? Because neural tissues have been lost, so there is obviously more space left within the central nervous system or within the ventricular system. There is also, when there is neural tissue is lost, when neurons are lost, why neurons will be lost? Because of the atrophy simply, or because of the infraction. If any person who is having an infraction or atrophy of the CNS, what are the disease conditions which cause atrophy of the central nervous tissue? For example, dementia or Parkinson's disease. There is obviously an atrophy of the cells of the nervous system. So whenever there is atrophy of the central nervous system, so what happens is there is a compensatory increase in the CSF, and then there will be no increase in the intracranial pressure. So this type of hydrocephalus is called as secondary hydrocephalus. This was regarding the types of the hydrocephalus. Now we have regarding morphological changes of the hydrocephalus. There is the increased intracranial pressure. We shall always know that whatever material is present inside, if it was thick, what will pressure cause? It will cause thinning of the ventricular system. So first morphological change which will be seen is thinning of the ventricles. So ventriculars, say for example, their thickness was 1 mm, and now because of the increased intracranial pressure, their thickness will only be, say for example, 0.5 mm. Okay, so thinning of the ventricular system. We learned about there will be dilatation of ventricles, and whenever there is dilatation and thinning of the ventricles, if we talk about the closure of the fontanelles, will the fontanelles close? No, because there is an increase in intracranial pressure. Now the ventricles have dilated. They would only close if the CSF pressure inside or the intracranial pressure was maintained within the normal limits. So there will also be failure in closure of the fontanelles will remain open fontanelles. So these are some of three main morphological changes which will happen in case of the hydrocephalus. First is dilatation of the ventricles, then also we have thinning and stretching. Also we can add stretching of the brain tissue, you can add, or you can simply say ventricles or ventricular system, you can say. And there is also failure to close. Morphological changes, types of the hydrocephalus, and regarding the pathophysiology of the hydrocephalus. So next we will be discussing about meningitis in the next class.